Hello, Medicare Advantage risk adjustment operators, innovators, and learners. Welcome to another learning series of the Hills Academy Risk Adjustment Made Easy, the Medicare Advantage kind. Thank you for joining us. Thank you for joining and learning with us again today. If today is your first time joining us, we want to say welcome. If you have been a seasoned learner with us as well, we want to say welcome as well for spending this time with us as we continue to learn on the topic that we've been learning on since the beginning of this month. If you have not subscribed to the channel yet, I will encourage you to like, to share, to subscribe to the channel. And as you study through as you study through this lesson, if it is helpful to you, I know it will also be helpful to somebody else who works in the same space. So feel free to like, to share, and also to pass on to share with others whom you know will benefit from this video. But otherwise, will benefit from this video. Throughout this month, we've been studying on Medicare Advantage plan types, and we have been learning several. We began with the introductory video, and then last week we picked on one of the key plan types that you will see as you navigate through Medicare Advantage data. But before, I want to remind you again of our CMS 101 Introduction to CMS class that is coming up on June 3rd and June 4th, 2025, between 7 and 8. This is a cohort class, and registration deadline is coming very quickly. So you want to click on the link here. Therefore, you want to click on the link here. Therefore, you want to click on the link here, or the link here, or the QR code. Scan it. Scan the QR code to sign up for the class. This class is to help you understand, navigate, and work smarter with CMS. So I look forward to seeing you there. Also, if you've missed our announcement of the second class that we'll be having, which is HCC-In-FHIR, it's RAS-FHIR 201 class. That is also another class that comes on from June 16th to the 18th, 2025. And also you can scan this QR code. You can scan this QR code to sign up for it. Which I'll be co-teaching with Dr. Yubin Park of Mimi Labs, and we are very excited for these classes, and we look forward to seeing you there. All right, let's move on to today's lesson. Looking at the Part C and D data, Part C and D data, which we have been using as an example for this time, you will recognize that you'll recognize the plan types from this. And as you deal with Medicare Advantage Part C and D data, you will see the plan types. So we started with local CCPs. we started with our local CCPs, and with the CCPs, we are local CCPs last week, which we have been learning more on, and today, seeing them as one of the largest plan types, that you will see in the Medicare Advantage risk adjustment space. So we will take the local CCPs today and go deeper into them. So there are types of CCPs, which are coordinated care plans, and we discussed what CCPs are from last week. So if you haven't watched the videos, I encourage you to watch them. So CCPs come with two different types, and there is a HMO, which is HMOs, which are mostly very restrictive form of the CCPs, has a gatekeeper, and also before you can go, you need a gatekeeper, which mostly is the PCP, the primary care physician. And within the CCP and within HMOs, and within the HMOs, there is the regular HMO, and also there is a HMO POS, which is point of service. And with that one, there are specific plan covered services that the plan may allow, and they are all stated in the plan documents and the plan documents. Allow for a beneficiary, which are all stated in the plan documents. The next level of the CCPs is the PPO, and sorry for the alphabet soup, which is Preferred Provider Organizations, PPOs. And within PPOs, that is less restrictive than the HMOs. And within PPOs, there is the local PPO and the regional PPO. The local PPO is within a local service area, and the regional PPO has a wider service area just to take care of some of the rural areas that the plan may cover within that. For PPOs versus HMOs, versus HMOs, the PPOs provides reimbursement for all covered services, even if it's in network or out of network. But and it has a wider network, but the cost sharing may differ as you move from an HMO to a PPO. The cost sharing may be higher within the PPO environment. The last part of the CCPs are the special need plans, which is SNPs. And there are three main areas of the special needs plans. There is a chronic conditions SNP, and there is a dual SNP, which is DSNP, and then there is ISNP, which is institutional SNP. And the SNP plans are for special needs, as it says. So these are special population that are allowed to enroll, that are required to enroll in these specific CCPs, specific coordinated care plans. So as I end, the types of CCPs that we've been looking at, there is the HMOs, there's the PPOs, and there's the SNP plan. So as you think through these different plan types, the key big one that you will see are CCPs, and then you will see the HMOs, which have the two-part the PPOs, which also has the 2-part, and the SLIP, which has the 3-part. So so that is therefore 3 parts. As I end, I want to invite you to our signature gifts, from chaos to clarity, the essential comparison cheat sheet on Medicare Advantage risk adjustment data sources, which compares MA data sources that are used for Medicare Advantage risk adjustment for you for free. And you can download your free copy on our website, www.thehealsacademy.com, as you go to the Medicare Advantage Encounter Data and Risk Adjustment Made Easy page. You will be able to download your free copy, and also you become part of our email list so that you don't miss anything from us. Otherwise, thank you so much. If this has been helpful to you, I would encourage you to like, to share, to subscribe, because it helps us to reach a wider audience, to be of helpful to many people in this space. Otherwise, thank you for spending the time with us, and we will catch you same time next week as we pick on the other parts of the other plan types. The other plan types. Thank you, and bye for now.